Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back, everyone. So we're going to start off with some numbers and a number of cases that are across Canada, and then the world numbers. It is important that we get this information out to you so that we can do what we need to do as just global citizens to do the social distancing and do what we need to do to keep the numbers of this pandemic down. So across Canada, we're at 1,432 cases. For British Columbia, where I am, is 424 cases. Alberta is 259 cases. Saskatchewan is at 33. Manitoba is at 11. Ontario at 425 cases. Quebec at 221 cases. New Brunswick 9 cases. Nova Scotia 28 cases. PEI 3 cases. Newfoundland Labrador is at 3 cases. Yukon is at 2 cases. Northwest Territories has 1 case, bringing us to the 1,432 cases. Number of deaths, we are up to 20 deaths due to COVID-19 across Canada. 10 are in British Columbia alone. So, globally, we are at 300,074 cases. And number of deaths are at 16,350, and recovered is 101,523 people have recovered from it. And our recovery rate, which was once at 10%, has now, or I should say, our recovery rate, which was at 90%, is now down to 86%. Maybe some of that has to do with social distancing, and I'm going to play a clip in a second about the social distancing after I tell you what I saw this morning at a local grocery store, where people were lined up to go into the grocery store. They were kind of bunched all together, lined up, waiting to go into a grocery store. I did have to do some grocery shopping myself. I chose not to stand in that lineup. I waited and moved on to another store, in which case, again, people were crowding together around different frozen food items and canned good items. They were just crowding around, trying to grasp at whatever food they could grab. One, the idea of hoarding is not such a great idea, and two, the social bunching together is how we're going to actually increase numbers. By all the experts, they're saying that if we keep bunching together, we are going to increase the number of infections. So I'm going to play this clip. Next, it is about social distancing and how people are trying to, even as much as call people out for not doing the social distancing and promote this idea of social distancing. So let's get that clip.
the message we've heard from health officials right up the chain to Dr. Theresa Tam saying, plank it, stay at home. We need to not just flatten that curve, but make it, plank straight across. You hear so many people turning to social media to express that message and tell people about the importance of social distancing. Let's go to Laura McQuillan, who's taking up that story for us this morning.
Heather, it's not just people sharing that message of social distancing, but people actually going as far as to call out others who are failing to do so. Yesterday we were talking about those spring breakers, but it's not just in the United States where this is happening. This is White Rock, BC just yesterday, and you can see a lot of people crowded together on that pier. They were lining up to go to stores there, so a lot of people not heeding the message, and really you wouldn't know there was a pandemic happening there. I want to show you some of the social media response to those crowds. One message posted online saying mass crowds gathering daily at the White Rock Pier despite COVID-19, that White Rock City Hall was offering no response to the huge crowds at the pier, waterfront and restaurants. And another post as well from White Rock saying that they are hearing that White Rock restaurants and the pier were packed, curving the curve, I guess, as you mentioned. They're trying to make it plank, flatten it out, but if people are gathered that closely together, it's not helping, and so people are calling this out online. And another subject of a call out is a Canadian star, Evangeline Lilly. You may remember her from the TV show Lost. She posted on Instagram a cup of her morning tea saying she'd just dropped her kids off at gymnastics camp. They all washed their hands before going in, playing and laughing, hashtag business as usual. Now, she was called out by fans who accused her of being selfish, of spreading misinformation about coronavirus online by not, being in lockdown, not keeping your kids inside, letting them go out and have that close contact with others. So remember that social distancing message. It's about physical distance. Keep away from others as much as you can. 1 to 2 meters is great. Of course, do keep up social interactions online by distance, because it is very important to be there for each other at this time, Heather. Laura.
Next up, a message from Justin Trudeau from his latest press conference.
Tony Dashi, here's the Prime Minister of Canada.
I want to begin by recognizing that a lot of people have now been stuck at home for a week or more because of COVID-19. If that's starting to take a toll, it's understandable. But we can't afford to stop now. I want to be clear. Social distancing, physical distancing, is the single best way to keep the people around you safe. What does that mean? It means keeping 2 meters between yourself and someone else. It means avoiding groups. It means staying home as much as possible. If you choose to ignore that advice, if you choose to get together with people or go to crowded places, you're not just putting yourself at risk, you're putting others at risk too. Your elderly relative who's in a senior's home, or your friend with a pre-existing condition, our nurses and doctors on the front lines, our workers stocking shelves at a grocery store. They need you to make the right choices. They need you to do your part. We've all seen the pictures online of people who seem to think they're invincible. Well, you're not. Enough is enough. Go home and stay home. This is what we all need to be doing. And we're going to make sure this happens, whether by educating people more on the risks or by enforcing the rules if that's needed. Nothing that could help is off the table. Today, we're launching federal advertising campaigns. You'll see faces that you know and trust, people from our cultural sector getting out the recommendations from our healthcare workers. Not having heard this message won't be an excuse. We're reaching everyone. Listening is your duty, and staying home is your way to serve. Every day, there are more and more people who step up and heed this call. Just yesterday, Team Canada and the Canadian Paralympic team made the tough decision not to send athletes to the Olympic and Paralympic Games this summer. I know this is heartbreaking for so many people. Athletes, coaches, staff, and fans. But this was absolutely the right call, and everyone should follow their lead. No matter who you are, if you're doing your part, I want to say thank you. You are saving lives. And when it gets hard, know that your government is right there with you. On Wednesday, we unveiled an $82 billion plan for people and businesses affected by the virus. If you're worried about making ends meet, we're putting more money in your pocket. If you own a small business, we're helping you bridge to better times. Tomorrow, the House of Commons will reconvene to pass emergency legislation and put this plan in motion. For farmers and people across the agri-food business, I know these are hard times too. So we're also opening up $5 billion in additional lending capacity. Starting today, farmers and producers can apply through Farm Credit Canada for the support they need to keep food growing and get it onto our tables. On that note, I want to say thank you to people right across the entire food sector. Day in and day out, you grow, transport, and stock the food that feed our families. Last week, we also announced a plan to mobilize industry so our hospitals have the medical support and equipment they need. Later today, I will have a call with the First Ministers to discuss our continued coordination on quarantine and self-isolation. We're working together to ensure that everyone has what they need, whether that's equipment for testing or medical supplies. This evening, the Premiers and I will also talk about continuing to move forward with measures to support families and small businesses to ensure our economy rebounds. For Canadians stranded abroad, we're working with airlines to get people home. People should be returning by commercial means while they're still available. Air Canada, WestJet, Air Transat, and Sunwing all have flights this week. As of today, we've secured authorizations for Air Canada to operate 3 flights for this week for Canadians in Peru, and there will be 2 more flights in the coming days from Morocco. We've also helped secure an Air Canada flight from Spain, as well as Air Transat flights, including 2 from Honduras and 1 each from Ecuador, El Salvador, and Guatemala. If you're a Canadian abroad, register with the government now so we can send you updates and contact you. You need to do this if you haven't done it already. Depuis le début de cette crise, on utilise tous les outils à notre disposition pour gérer la situation. On est chanceux, les innovateurs canadiens sont
because
parmi les
Canadian
meilleurs.
innovators are among the best in the world, and they want to be part of the solution. We invested $275 million in research on coronavirus and the development of vaccines. Antiviral treatments are things that we absolutely must do. We can see this with the flu. Vaccines prevent people from getting ill, protect the most vulnerable, and ensure that fewer and fewer people end up in the emergency department. Today, I am announcing that we will be investing $192 million to provide direct support to the development and production of vaccines in Canada. This would be a long-term solution to the coronavirus. We will be supporting the work of companies in Vancouver to fight COVID-19. We are also working with Mikado in Quebec to produce and test vaccines. At the same time, we have provided funds to vaccine and infectious disease organizations in Saskatchewan for the development of vaccines and clinical trials. Canada needs that in order to provide mass treatment as soon as possible. We are also investing in the National Research Council's facilities in Montreal.
$192 million to directly support vaccine development and production in Canada. We're investing in a long-term solution to COVID-19 right here at home. Our government will be signing an agreement with Vancouver-based AbCellera to support their work on drugs to prevent and treat COVID-19. We're also working with Quebec City-based Medicago for vaccine testing and production. At the same time, we're providing funding for the University of Saskatchewan's Vaccine and Infectious Disease Organization for development and clinical trials. Once there are promising options, Canada needs the capacity to mass produce treatments as quickly as possible. That's why we're investing in the National Research Council of Canada's facility in Montreal to prepare for the rollout. These are critical steps forward. We have to remember that vaccines won't be ready overnight. They will take months to develop and test. So while that's happening, we need to work to mitigate the impacts of this virus. And luckily, we have the tools we need right here at home. Blue Dot in Toronto was among the first in the world to identify the spread of COVID-19, coming in 9 days ahead of the World Health Organization's public warning. We've signed a contract to use this Canadian software to model the disease. It will help us track and therefore slow the spread. Minister Baines has also sent a call to action to every university, college, polytechnic, and CEGEP in the country. Their labs have the resources and expertise to be part of this fight. We've asked them to identify equipment they've got, like masks and ventilators. At the same time, we're looking at innovative solutions they can be part of, including 3D printing of medical supplies. Many institutions have already stepped up, and many more will do the same. If you need more information, please go to buyandsell.gc.ca. We need all hands on deck. Nous demandons à chaque université, collège, école polytechnique et cégep du pays de nous donner tous les masques et ventilateurs qu'ils ont ou de nous proposer d'autres façons d'aider, par exemple avec une imprimante 3D. Beaucoup d'établissements ont déjà répondu à l'appel et beaucoup d'autres pensent à le faire. Pour plus de renseignements, consultez le site achat-et-vente.gc.ca.
Sell.gc.ca. We all have a role to play in the fight against COVID-19. Even if you're not a first responder or a researcher, you can save lives. By remaining at home as much as possible, maintaining a distance of at least 2 meters from others if you must go out, you can do and make a difference. That's how we can protect ourselves, protect our nurses and doctors, and our healthcare professionals who are caring people who need help. Please follow the recommendations of our public health officials. We have to trust them, and we have to listen. Yesterday, I had an opportunity to talk to some people directly, and today I'm thinking about our seniors. We all have loved ones who are at home, who are extremely vulnerable. Call them. Tell them that you love them. I myself am thinking of my father-in-law, who is receiving treatment for a cancer and has been a few months, so we haven't seen him for a while. Today is his birthday. He is 77 today. Happy birthday, Jean-Jean. Think of your own loved ones and do whatever you can to keep them safe. That is how we can stop COVID-19. Thank you for doing your part, and know that our government will continue to work all the time to protect you, and together we will come through this. Thank you very much.
And press conference from Adrian Dixon, Dr. Bonnie Henry, talking about measures that are being taken and measures to help ensure that we have enough beds for those who become sick, and how we also, again, getting back to flattening that curve so that we can keep the number of cases down at one time. The idea is to keep the curve so that it doesn't exceed the number of beds and the number of healthcare workers that we actually have to help keep everybody alive. So, here we go.
Speaking people of the Sanghees and Esquimalt First Nations. To start, I wanted to present the schedule for the week. Today, obviously, we're at 10 a.m. on Monday. From Tuesday to Friday, we'll be at the briefings will be at 3 p.m. They'll all be taking place here in Victoria at the Press Gallery Theatre. To our broadcasters who created a pool video system that reduces the number of cameras in the room, we thank you for doing that. And for smaller outlets who are unable to join the pool, a reminder, you can stream video of our news conferences in real time on the BC Government Facebook and Twitter feed, so that information, that video is available to you. On Monday, today and tomorrow, Dr. Henry and I will be briefing. On Wednesday and Thursday, it'll be just Dr. Henry, and on Friday, it will be the two of us again. We are, as you would expect, especially for Dr. Henry, trying to reduce travel in our own circumstances and to only do absolutely necessary travel. So that's what the briefing schedule will look like this week. In addition, there will likely be a special briefing session which will involve a background and a pre-briefing on specifics involving modeling, which we will modeling of COVID-19, which we'll inform you of in due course. But for today's briefing, I want to introduce Dr. Henry.
Thank you and good morning. So for today, we have a number of new cases. We're reporting on the cases that have tested positive since our last briefing on Saturday morning. The number of new cases is 48, giving us a total number of test positive cases of 472 here in British Columbia. Of those, 248 are in Vancouver Coastal Health, 150 in Fraser Health, 39 on Vancouver Island, 30 in Interior Health Region, and 5 in Northern Health Region. Of those, 33 people are currently hospitalized, and 14 of those in hospital are in the intensive care unit. In addition, we've had 3 additional deaths over the last 2 days. One, a resident of the Lynn Valley Care Centre, one a resident of Harrow Park, unfortunately, and another a community dwelling resident in the Fraser Health region. So we're very saddened, of course, by the passing of these people. On a more positive note, we have finally got enough testing and symptom resolution back to be able to say we now have 100 people who have been considered recovered and released from isolation. So that is a really good thing to be able to put that on our books finally. As I have mentioned, many of the people who have tested positive have had very, very mild illness and have been recovered for some time. So the criteria for being able to allow them to come out of isolation has finally been met for most of them now. In addition, we have 6 now long-term care facilities that have been affected by COVID-19. The Lynn Valley Care Centre, we now have 36 residents and 19 healthcare workers who are affected there. Hollyburn is the same. The Harrow Park has increased by a few. We're now have 10 residents and 12 healthcare workers who have tested positive at that facility. The 2 new facilities are the German Canada House in Vancouver Coastal Health, where 1 staff person has been affected so far, and an outbreak response is ongoing at that facility, and the Delta View Long-Term Care Centre in Fraser Health. Again, 1 staff person was identified as positive, and a full outbreak response is happening at that facility as well. We have been working diligently in our lab system, and as we've talked about over the last week, it has been a challenge for the lab to keep up with the volume of testing, and we've done over 18,000 tests, as you're aware, and the backlog of testing that had accumulated over the past week and a half is mostly resolved, and we're hoping it will be completely resolved by the end of today or tomorrow, so that is great. We've also ramped up the capacity so that we're able to test as widely as we need to. We have changed our criteria for testing, as you know, to focus on healthcare workers, on long-term care, on clusters and cases in the community that are not linked to travel, where we recognize that for the large number of people who have traveled back to to British Columbia from outside Canada. Self-isolation is what they need to do, even if they have mild symptoms, and they do not need to have a test in those cases. We will be posting, of course, the testing numbers as well on a more regular basis in the coming days. I also presented some information about both the testing curve, but also what we call the epidemic curve with the onset of illness on Saturday, and that information will be updated on a daily basis and will be posted on the BC CDC website. I know there has been some concern expressed that our change in our strategy for testing means that there's a bunch of cases that we're actually not getting to or that we're not recognizing in the community. And while we do recognize that people who have symptoms and they've had an exposure may have this disease, it doesn't mean that everybody needs to be tested. But we will be posting what we call epidemiologic linked cases as well. So if I'm in a family, for example, and one person in the family has tested positive and I develop similar symptoms and able to be managed at home, we don't necessarily need to test you, but we'll call you a case, an epidemically linked case. So we will be posting that information as well as we get that information going in our epidemiologic summaries. So that will give you a better sense of the numbers of people who have been affected by this disease here in BC. So there has been, as I'm sure everybody in this room is aware, monumental changes in the past week across British Columbia, across all of our communities, in trying to put in place measures to physically distance people and ensure we're doing everything we can to slow down and stop the transmission of this virus in our communities. And for the most part, despite what we've been seeing on social media and some of the concerns that are expressed, people are doing their part. But we cannot let up. And we do need to be sure that we're addressing some of those issues that we have seen with people congregating in groups and often roadside where it's very visible. So I'm, again, ensuring that people that it is okay if you're not in self-isolation. Yes, you can go outside, but go only with your family members in small groups. Maintain those distances. It is important for us to keep our health and mental health going as well through this. And we also need to maintain essential services. And I know there's been I've been receiving reports that people are confused about what they need to do and how they need to do it. But it is incredibly important for us that all of us can manage this only by making sure that we have essential services going. So things like our grocery stores are essential, our banks, our pharmacies. But we need to have safe measures so that we can all get the food that we need, get the medications we need in a safe way. And I know many, many places are taking those measures, and I'm really heartened by that. So we'll be working with them to make sure that we have those things in place to best protect everybody, but continue to be able to support each other and to work on and to ensure we have what we need to get through this next few weeks to months. I also want to talk about the importance of doing these things to protect our healthcare workers and our healthcare system. As we know, healthcare workers are really the heart of our response to this pandemic, and they face risks both in the community and at work. So those community measures we are taking are incredibly important for protecting our nurses, our doctors, our care aides, the people who work in all of our healthcare facilities as well. In addition, as you know, we have a number of long-term care homes that have been affected, and we know that people in long-term care are of the most vulnerable for having severe illness with COVID-19. So the health authorities, particularly here in the Lower Mainland that are most affected, will be implementing additional measures at long-term care. And I know that this will be a challenge for some people in our community because you will not be able to see your loved one as simply and as easily as we have in the past. And I know the long-term care homes are going out of their way to try and put in provisions to allow you to connect, even if you're not physically present. We also will be screening long-term care workers as they come into work every day and providing clear guidance on the use of personal protective equipment to protect themselves, their colleagues, and our patients. And also I'm appealing to my colleagues in healthcare that we need to really have a heightened awareness of our symptoms. We've been saying from the very beginning that many people, especially young healthy people, which most of our healthcare workforce is, can have very mild symptoms, and we can pass it on to each other when we're in the break rooms, when we're working together on the ward, and we can pass it on to our patients. So we need to have a heightened awareness of even very mild symptoms and ensure we take the physical distancing measures that we need and are able to maintain our services in a safe way. So I mentioned already that we shared the epidemiologic curve and more information will come, but we still need to work together to flatten this curve. Every day that you and your family stay distanced from others and follow the important things that we talked about from the very beginning of this, cleaning our hands regularly, covering our mouth when we cough, enhanced cleaning measures in our community and in our homes. The more that we do this, the better prepared we will be for the coming days and coming weeks. And we must do everything possible every day to protect our communities and protect our loved ones.
All right. So that was Bonnie Henry. And notice during that report that she mentioned a number of healthcare workers that have been affected. We have to by doing the social distancing and keeping away from each other, staying indoors as much as possible, or if we go out, we go in small groups and we stay away from bunching together into large groups and crowding at landmarks and things like that. We are actually enabling our healthcare workers to do the job they're supposed to do and do it safely. And that's part of the message that everybody's getting at here is, yes, there are people who are going to get sick, but we have to make sure that we are protecting the most vulnerable and also protecting those who will heal us. So that's something to keep in mind with this. Okay. Next, we're going to go to the WHO, and they have decided to partner up with FIFA to get the message out about how to keep numbers down and how to help globally combat against COVID-19. So here's that.
Thank you very much, Margaret. And good morning, good afternoon, and good evening, wherever you are. Less than 6 months ago, WHO and FIFA signed an agreement to work together to promote health through football. We didn't know then what we know now, that a new virus would emerge that would bring many parts of society to a standstill, including the beautiful game itself. Many football matches have stopped, but our collaboration has become even more important during these difficult times. In fact, it's given us the opportunity of working together more closely than we imagined with FIFA. Football can reach millions of people, especially younger people, that public health officials cannot. Today, it's my great pleasure to welcome my dear brother Gianni Infantino, President of FIFA, to talk about our joint campaign to pass the message to kick out coronavirus. I'll repeat that. This is a campaign we're starting jointly called Pass the Message to kick out coronavirus. Pass the message to kick out coronavirus. I would also like to take this opportunity to thank FIFA for its generous contribution of $10 million to the COVID-19 Solidarity Response Fund. Thank you, my brother, for your generous contribution. To date, the fund has raised more than $70 million in just 10 days from more than 187,000 individuals and organizations. To help health workers on the front line to do their life-saving work, treat patients, and advance research and treatment and vaccines. I would also like to thank TikTok for its contribution of additional $10 million and for its valuable support in helping to reach its large young audience with reliable health information. Speaking of which, our new WhatsApp health alert, I will repeat this, speaking of which, our new WhatsApp health alert has now attracted 10 million users since we launched it last Friday. This is just in 4 days. Delivering reliable health information directly to their mobile phones. Details on how to sign up are on the front page of our website. The Arabic, French, and Spanish versions will be launched this week. And this is the best way to be connected directly with people. So thank you, Gianni, for your support and the support of the whole footballing community. And I would like to give you the floor to say a few words, but I would like to also recognize that it's your birthday today. So I would like to say happy birthday, my dear brother, and thank you so much for joining us today. Happy birthday, Gianni, again. Thank you.
Well, thank you very much to my dear brother Tedros, Dr. Tedros. Thank you. My heartfelt thanks for the opportunity to be here at the WHO today. First and foremost, I would like to express our deepest condolences, of course, to all the families of those who have lost their lives across the world as victims of the coronavirus. I would also like to thank everyone, especially those involved in the medical profession, who continue to put the lives of others in front of their own in fighting this disease. We are all in their debt, and their example should encourage us to follow the advice that we are given. So now regarding the campaign, dear Tedros, dear friends, football means so much to billions of people around the world. So it is clear to me that we have to show leadership and solidarity in these difficult days. When you announced, dear Tedros, on a Thursday afternoon at 5 o'clock that this was a pandemic, on the Friday at 9 o'clock I was in your office asking you, how can football help? What can we do? So we have to get the message across the world, and football wants to help. This campaign actually came to us. We didn't need to go looking for it. There are no actors in this campaign, just the players themselves, and they all want to highlight the advice that is provided to all of us, to all of them, by the WHO. For that, I would like to thank all these football players, all the legends who are part of this campaign for making it possible. And actually, the FIFA team's dear Tedros includes, of course, the greatest footballers in the world, but also our 211 member countries and the 6 continental confederations. Together we are going to roll out this campaign in the next days in videos, in graphics, and in many languages, so we can really pass the message to kick out coronavirus. Well, I think that this virus has shown to all of us 2 things. One is how vulnerable we are, and the other, how global the world has become. Exceptional situations require exceptional measures, and global problems require global solutions. We have to make sure that we recover from this by bringing the entire world together as one and reminding everyone that we are all one kind, the humankind. We have to prove that we are capable of extraordinary global acts of solidarity all together, because health comes first. Everything else comes after. So now we have to be strong. We have to follow the guidance of the WHO, of our governments, and after we'll have to rebuild our relations, maybe and hopefully with more solidarity and understanding for each other. Football is ready to play its part on that, and we are here for that. And I'm sure of one thing, that like in football, by acting together with determination, discipline, and teamwork, we will win. Thank you.
Thank you. Grazie mille, fratello. Grazie mille, Gianni. And now I would like to call Alison Becker, our ambassador, WHO ambassador, who is online, you know, the best goalkeeper, and he plays for Liverpool, and he's from Brazil. Obrigado, Alison, for joining us, and the floor is yours. Please.
Hi, Dr. Tedros. Hi, everybody. Good morning, good evening, good afternoon. Mr. Gianni, first of all, happy birthday for you. I would like to say that this is a great opportunity for me to be together with you, being part of this movement that is starting now, that is starting today. Pass the message to kick out the coronavirus. We football players, we used to act together. We used to work together, to train together. I know now in this tough moment, tough times, everybody have changed the life for something, so for staying home, cannot going out, cannot go into the work. In my case, I'm not able to be together with my colleagues, with my teammates, to do what I love, what is my passion. I was made for playing football, and now, because of these tough times, we are not able to do that, to bring happiness for the people through football. But we also understand that is necessary. It's necessary to stay home. It's necessary to think on the next, to be solidarity. I think in this moment, I believe in this moment, we have to put our solidarity out. It's the moment that we have to put our passion out and think on the next. And I am glad to participate of this movement, because the people need the right information. It's necessary in these moments that we have the right information, and also that we follow the right information. So I would like to say for the people follow the information from the local authorities, try to follow the information from WHO. We can trust on them, we can trust that is the right thing to do. And we understand also that health comes first in this moment. It's time, like in football, to have a teamwork. Everybody doing their own job. That includes to be safe, to be at home, to follow the advices. For example, washing hands properly, from keeping this distance from the people, but we can't forget that we need now to work as a team. So I would like to show my support for pass the message to kick out coronavirus and say to you, thank you for being participating, for letting me participate of this movement now that is tough times, and we also need to trust in ourselves, trust in the human capacity to go through adversities. It's not the first time in our lives that we need to overcome from something bad. But now we need the participation from everybody. So I would like again to say thank you. Thank you, Dr. Tedros, and thank you, Gianni.
My little Portuguese, muito obrigado, meu irmão. I hope that's the right one. Obrigado, my brother. Thank you, Alice. Thank you for being our ambassador. Please pass my greetings to your wife also. You both as a partner, as a pair are helping us as ambassadors. So thank you so much. Good to hear from you today, and look forward also to hear from Natalia. More than 300,000 cases of COVID-19 have now been reported to WHO from almost every country in the world. That's heartbreaking. The pandemic is accelerating. It took 67 days from the first reported case to reach the first 100,000 cases. 11 days for the second 100,000 cases. And just 4 days for the third 100,000 cases. You can see how the virus is accelerating. But we're not prisoners to statistics. We're not helpless bystanders. We can change the trajectory of this pandemic. Numbers matter because they're not just numbers. They are people whose lives and families have been turned upside down. But what matters most is what we do. You can't win a football game only by defending. You have to attack as well. And my brother Gianni can tell you more. Asking people to stay at home and other physical distancing measures are an important way of slowing down the spread of the virus and buying time. But they are defensive measures that will not help us to win. To win, we need to attack the virus with aggressive and targeted tactics, testing every suspected case, isolating and caring for every confirmed case, and tracing and quarantining every close contact. We recognize that some countries are struggling with the capacity to carry out these offensive measures. Several countries have shown that mobilizing resources internally from less affected regions is one way to increase capacity and help the overwhelmed health system in some regions. We are also grateful that several countries have sent emergency medical teams to care for patients and train health workers in other countries that need support. This is an incredible example of international solidarity. But it's not an accident. WHO has been working with countries for years to build a network of emergency medical teams for exactly this eventuality, to provide surge capacity of high-quality health professionals who can be deployed to care for patients and save lives. And I would like to use this opportunity to thank all countries who have contributed their emergency medical teams to support other countries. Health workers can only do their jobs effectively when they can do their jobs safely. We continue to hear alarming reports from around the world of large numbers of infections among health workers. Even if we do everything else right, if we don't prioritize protecting health workers, many people will die because the health worker who could have saved their lives is sick. As you know, WHO has been working hard with many partners to rationalize and prioritize the use of personal protective equipment. Addressing the global shortage of these life-saving tools means addressing every part of the supply chain, from raw materials to finished products. Measures put in place to slow the spread of the virus may have unintended consequences of exacerbating shortages of essential protective gear and the materials needed to make them. Solving this problem requires political commitment and political coordination at the global level. This week, I will be addressing heads of state and government from the G20 countries. Among other issues, I will be asking them to work together to increase production, avoid export bans, and ensure equity of distribution on the basis of need. We need unity in the G20 countries who have more than 80% of the global GDP. Commitment, political commitment at the G20 level means a very strong solidarity that can help us to move forward and fight this pandemic in the strongest terms possible. So while asking the specific issues, the three issues I said, the most important ask to G20 leaders is solidarity, to be one and to act as one, because they have the biggest stake in the world in all respects. We also recognize that there is a desperate need for effective therapeutics. There is currently no treatment that has been proven to be effective against COVID-19. It's great to see the level of energy now being directed to research and development against COVID-19. Small observational and non-randomized studies will not give us the answers we need. Using untested medicines without the right evidence could raise false hope and even do more harm than good and cause a shortage of essential medicines that are needed to treat other diseases. That's why WHO has launched the Solidarity Trial to generate robust, high-quality evidence as fast as possible. I'm glad that many countries have joined the Solidarity Trial that will help us to move with speed and volume. The more countries that sign up the Solidarity Trial and other large studies, the faster we will get results on which drugs work and the more lives we will be able to save. Through Solidarity Trial, we will move faster and we will do bigger. And of course, with good quality. Faster, bigger, and good quality. So I would like to end by reminding everyone that although COVID-19 is dominating the world's attention, there is another respiratory disease that's both preventable and treatable, but which kills 1.5 million people every year. And that disease is the old-timer tuberculosis. As you know, tomorrow is World TB Day. An opportunity to remind world leaders of the commitments they have made to end the suffering and death caused by this ancient and terrible disease. The world is rightly responding to COVID-19 with urgency and purpose. We call on the global community to harness that same urgency and purpose for the fight against tuberculosis and for a healthier, safer, fairer world for everyone. The rule of the game to kick COVID-19 out, as we have agreed with my brother Gianni, is to kick it out, and that game is solidarity. So myself and my brother Gianni ask for solidarity to kick out this virus. I thank you.
To leave on a very positive note, one thing that I will say is that COVID-19 is bringing people together in a loving and caring manner. I know we've talked about people with the hoarding and things like that, and people buying more than what they need, and leaving others without. But here's a note left on a shelf near an apartment building for neighbors in need. Hi neighbors, please take what you need. If you know of a neighbor who might need an item, please take it for him or her. Let's continue to check up on each other. during this time from a neighbor. Be the neighbor that checks up on people. You don't have to actually go inside their house. You can just simply knock on the door and talk and give phone calls and find out what people need. If you go buy grocery items for someone who is vulnerable, drop it at their front door, and they can bring it inside from there. All right, that's our broadcast for today. We will check in with you later on as things develop. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.